All right, hello. My name is Avery, and this is my final presentation in our policy cycle series. So, today I'm going to be focusing on the impact, evaluation, and change phases of the federal response to the synthetic opioid crisis, with a special focus on medication assisted treatment, or MAT as I'll be referring to it, and naloxone expansion and access. So, first, I just wanted to start with why evaluation is even important. So, expanding MAT and naloxone distributions only really matter if those changes will translate into real improvements for people. Evaluation, especially, is important because drug policy has a long history of investing in programs without actually measuring whether they reduce harm. To know whether the policy is working, agencies like the Substance Abuse and Mental Health Services Administration and the Department of Health and Human Services, they need consistent and reliable indicators of what is changing. So we need to know, are more people getting into treatment? Are treatment outcomes improving? Are rural counties seeing progress, or are they still being left behind? These evaluations can build on existing state opioid response program standards, which already requires states to report performance and access measures. So, next are our key impact indicators. The most important indicators include overdose deaths and MAT enrollment, waitlist times, and whether patients are actually staying in treatment. So, retention is especially important. One study that I included in my proposal paper found that different MAT programs have very different retention rates, and the patients who stay in treatment longer consistently experience better outcomes in the long run. So, retention, which can be measured at 30, 90, and 80, 180 days, this tells us just a lot more about effectiveness than just the enrollment numbers on their own. For naloxone, the indicators include the number of doses distributed, how often naloxone is used during emergencies, and how many counties have consistent coverage. Most EMS agencies already track these things, luckily, which makes national monitoring a lot more realistic. And then researchers can then compare rural access before and after the policies are implemented. So, since rural areas face longer travel times and fewer map providers, seeing improvements there are will be a really good sign of success. So, once those indicators are consistently monitored, agencies can start seeing early signs of progress. Naloxone's impact shows up very quickly, practically immediately, but treatment improvements take more time. So, one early positive sign would be increasing mat retention in rural communities, especially because of those longer travel times and provider shortages I mentioned earlier. These make it hard for people to stay engaged in treatment. Another important trend is that bystander naloxone use actually increased by over 40% between 2020 and 2022. So that just shows that these take home naloxone programs are working and that community members are able to intervene before EMS arrives, meaning less fatal overdoses. And then finally, shorter travel times and more telehealth access and better county level coverage as well are all signs that rural access is improving. So, realistic evaluation timeline is going to be about 3 to 5 years with annual progress checks built in. This timeline is really important because MAP programs take time to scale up. So, hiring providers, expanding telehealth, and reducing waitlists obviously aren't instant processes. If agencies evaluate too early, they might think the policy isn't working only because the infrastructure just hasn't caught up yet. But annual check ins just help agencies determine whether overdose deaths are falling, whether treatment access is improving, and whether improvement is spread evenly across all regions. So, once evaluation results are available, we can use them to make policy adjustments. If the data shows increased access and fewer overdose deaths, agencies can expand state opioid response grant funding or support additional MAP providers. And on the other hand, if evaluation shows that some regions are still struggling, whether that be with provider shortages, uneven naloxone coverage, or just overall weak implementation of opioid response programs, that's going to need to be fixed. So agencies can redirect funding to the areas falling behind just to make sure resources reach the communities who truly need them the most. Okay, so beyond immediate changes, policy evaluation helps policymakers learn what works in the long term. So, continuous monitoring allows agencies to understand and identify which strategies are most effective in rural versus urban areas. So, it also helps build stronger and more stable treatment and harm reduction systems, which are both necessary for any kind of long term reductions in overdose deaths. These systems can become better prepared to respond not just to fentanyl, even, but just to any other emerging drugs and changing patterns. So, to conclude, evaluation is what turns data into meaningful change. So, by tracking indicators like MAT retention, overdose reversals, and rural access, we can see whether MAT and naloxone expansions are really meeting their intended goals. If gaps appear, evaluation allows agencies to redirect their funding and make sure it's equitable across all communities. In the long term, this process strengthens our national response to the opioid crisis and just helps build a more effective system overall. And thank you.